Atrial fibrillation is an irregular, often rapid heart rate that commonly causes poor blood flow. Did you know that the average person with atrial fibrillation is 5 times more likely to have a stroke than someone with a regular heartbeat? Astonishingly, 80% of strokes are preventable, and further education could save thousands of lives every year. One option for stroke risk reduction is a left atrial appendage closure implant, which has been implanted in more than 50,000 patients worldwide. This device is a stroke risk reduction option for high-risk patients with non-valvular AFib seeking an alternative to blood-thinning medications that may require a lifetime commitment. Dr. Jay Franklin explains AFib and offers an alternative to blood thinners if you're a cardiology patient with a history of bleeding or a condition that puts you at risk for bleeding.
Atrial fibrillation is a very common, non-life-threatening nuisance rhythm abnormality that's happening to an increasing number of patients both in the United States and worldwide. For patients that cannot take blood thinners, we can use left atrial appendage occlusion or blocking of the left atrial appendage so that if clots occur, they cannot dislodge to the rest of the body to cause strokes.
Baylor Scott and White Heart and Vascular Hospital Dallas is a nationally recognized leader in the treatment of AFib. This implantable device has a proven record of safety, over 10 years of clinical studies in more than 2,000 patients. It is also the only device of its kind approved by the U.S. Food and Drug Administration.
The procedure is done with the patient asleep. We place the device in a beating heart and it fits in position, and we're able to confirm that we have a fit for each individual. Patients will go home on a blood thinner but then transition to just an aspirin a day. We have a number of specially trained physicians for placement of left atrial appendage occlusion systems at Baylor Scott and White Heart and Vascular Hospital.